Hi, I am Dr. Abhinav Sharma, Senior Consultant, Pediatrics and Neonatology, Cloudnine, Gomti, Nagar, Lucknow. So, the question is, how do we give surfactant to a preterm baby and what is minimally invasive surfactant? Now, whenever we have to give a surfactant to a baby, we have to choose the candidate depending upon the level of respiratory support the baby needs. Any baby who is on CPAP and has a requirement of more than 30% oxygen will need surfactant. The surfactant is required these babies from requiring the need of invasive ventilation. All the babies who are preterm less than 32 weeks of gestation who require mechanical ventilation right from the start after the birth need surfactant. Surfactant in these babies can be given by two techniques. All the babies who are on ventilation needs to be given surfactant via INSURE technique, wherein INSURE technique ET is already there in case of ventilated babies, or in the babies who are on CPAP first needs to be intubated, then a thin orogastric tube is passed via the endotracheal tube and the surfactant is then given in 2 or 3 boluses. This is followed by mechanical ventilation, giving either by a self-resuscitation bag or by connecting it to the ventilator that allows for the dispersal of the surfactant into the lungs. Is there any other technique for giving the surfactant in those babies? Yes. In those babies who are on spontaneous breathing or on non-invasive modes of support like CPAP or non-invasive ventilation can also be given surfactant without intubation. This technique is called as Minimally Invasive Surfactant Technique, and the different names are given to this technique depending upon the interface that we are using. Commonly in our setting we use a thin catheter that is passed under the laryngoscopic guidance through the vocal cords. The position of the catheter is guided by a black tip that has to be guided beyond the vocal cords. After the catheter has been positioned inside the larynx, then it is fixated on the heart palate using the index finger of the care provider. Then the surfactant is given to the external end of the catheter via a syringe in 2 or 3 doses. The baby breathes spontaneously, and the spontaneous breathing allows for a better distribution of surfactant as compared to giving artificial breathing either by a self-resuscitation bag or through ventilation. Long-term evidence for the babies who are less than 32 weeks of gestation, giving surfactant through a minimally invasive technique has been found to reduce the need for mechanical ventilation, reduce the incidence of air leaks or the escape of air into the pleura that we call as pneumothorax, and reduce the need for long-term oxygen that we call as bronchopulmonary dysplasia. Thank you.